Concussions have long been a problem for athletes. However, recent injuries and deaths have prompted new guidelines, urging coaches to take their players off the field if there is even a remote chance that the athlete has a concussion. I spoke with Jolene Henning, chair of the Department of Athletic Training at High Point University, about the new guidelines.
Yeah, we've always had guidelines in place, and so when you talk about the new guidelines that came out, I assume you're referencing the American Academy of Neurology guidelines that just came out last month. And essentially, that's saying if a patient at any level of play presents with signs and symptoms of a concussion, then they must be pulled out of activity and they cannot return to participation that day. It's important to note that those are guidelines, and so how that plays out in different levels of sport really varies. In North Carolina, for example, we have a state law. It's called the Gefeller-Waller Law. The law indicates if you're in a high school or middle school situation and you present with signs and symptoms of a concussion, you have to be pulled out. You can't return to play that day. So we've already had that in place, even though the American Academy of Neurology just came out with those guidelines last month. It's already been in place here. It's important to note that diagnosing and managing a concussion has multiple pieces. It's like a puzzle. So if we only relied on the symptoms that they told us about, then we would be in a lot of danger of just relying on that. But because we also assess balance and cognitive function, those are things that they can't hide.
Yeah.
They can't lie about it. So if we only relied on symptoms, that would be problematic because, yeah, they do lie, absolutely.
HPU junior Taylor Adwar was one of the athletes that denied having a concussion so that he could continue to play. Did any of your friends fake that they were okay, like say that they were fine so that they didn't?
I was fine when I knew I wasn't, because I wanted to play after getting hit in the head. And not gonna lie, I was able to play after, and then I felt the side effects after the game, and I dealt with it after.
Yeah.
And it wasn't the smartest decision in the world because concussions should be taken very seriously.
HPU senior Lucy Finley has suffered multiple concussions.
It does irreparable damage, and I think it's so important to be able to recognize that early and prevent any chance of that happening.
Do you still feel like the effects of your concussions?
Absolutely. I think part of that is having had so many, having 7 to 10 concussions. But I'll be sitting there doing an essay and I'll just lose focus, or I'll stare at my computer and not know what I'm doing. And the most frustrating thing is that I can feel it happening and that I recognize it. So it has insane long-term effects.
Patients present with dementia, personality changes where you think they're often going through a midlife crisis. Some of them become very violent. And so as we learn more and more about the long-term consequences of concussions or even subconcussive blows, we're going to start to see, I predict, more changes in the rules of the game.
Will sports change in order to avoid concussions? Only time will tell. For HPU News, I'm Olivia French.